This is MacKenzie Milbrandt, and welcome to my Applied Practical Experience presentation. I am a student of Eastern Washington University in the Master of Public Health program. I completed my Applied Practical Experience, or APE, from January 2nd to February 16th, 2024. This presentation is accumulation of my Applied Practical Experience projects during the first winter quarter of 2024. Completed projects, activities, and learning experiences are reflected upon in this report. My role as a student was I met with Dr. Kennedy, my site supervisor, to discuss my applied practical experience and Glacier Community Health Center's needs. There were several tasks discussed, with the central focus being patient support and resources. My applied practical experience location was Glacier Community Health Center in Cut Bank, Montana, and my site supervisor was Dr. Danielle Kennedy, pictured in the upper right. The main work products that were focused upon during my applied practical experience were an adolescent and adult social determinants of health patient support questionnaires, a community resource guide for Glacier County residents, and an oral health resource guide for their dental department. Work product number 1 was to create an adolescent and an adult social determinants of health patient support questionnaire and determine its implementation protocol at Glacier Community Health Center. To describe the product, I utilized interprofessional collaboration to create an adult and adolescent patient support questionnaire and implementation protocol Glacier Community Health Center's medical, dental, and behavioral health departments can utilize to determine patients' barriers to health care. The idea of creating social determinants of health patient support questionnaires was initially sparked during a leadership meeting at Glacier Community Health Center. The medical director, Dr. Atherton, brought to the group's attention that the community health clinic wasn't asking about or directly addressing patients' social determinants of health. My site supervisor and the director of operations decided it would be a mutually beneficial project for my public health growth and the clinic. After an initial meeting with the site supervisor, I began researching social determinants of health questionnaires and Glacier County's main barriers to health care. After research and another meeting with my site supervisor, we decided that interprofessional collaboration with the medical, dental, and behavioral health departments would create a thorough questionnaire that could be used throughout the clinic. Ideas were collected from the first meeting, and I developed an adult and an adolescent social determinants of health questionnaire that would be viewed and evaluated at follow-up meetings. I created an implementation plan through interprofessional collaboration with Glacier Community Health Center's medical providers, dental providers, behavioral health providers, the care coordinator, and the director of operations. The director of operations and the care coordinator would follow through with implementation according to the implementation plan. They will evaluate implementation monthly for 3 months following implementation and make changes as needed. The anticipated outcome is that Glacier Community Health Center will be able to meet its patients' needs more thoroughly, leading to better treatment outcomes. Creation of both the adult and adolescent social determinants of health patient support questionnaire and the implementation plan are the outputs. The questionnaires and the implementation plan were modified during the interprofessional meetings. The site director of operations will complete the evaluation of implementation post-implementation at Glacier Community Health Center. On this slide, here are a few examples. The first is the adolescent patient support questionnaire, followed by the adult patient support questionnaire. Wording within the intro paragraph is changed just a little bit per age demographic, as well as the needs listed below to meet specific age groups and make it more applicable. Work product number 2 was to create a community resource guide for Glacier County residents. I collaborated with Glacier County businesses, coalitions, and community members to create a comprehensive community resource guide available to anyone in need. Glacier Community Health Center providers were excited about the previous work activity I discussed. Number 1, the social determinants of health patient support questionnaires. However, they felt concerned about not having proper resources to help guide community members in their areas of need. In the past, there have been a couple of community resource guides for Glacier County, but they haven't been updated recently and aren't all-inclusive. This concern led to the development of my work activity number 2. The Director of Operations asked me to dig deep into the community and surrounding communities to discover resources available for patients who struggle with things like transportation, food supply, disabilities, housing, etc. The Community Resource Guide lists information on services and assistance programs tailored towards Glacier County and the surrounding areas. Through research, in-person communication, phone, and email communication, the collaboration with local businesses and community members, I have gathered a comprehensive list of services offered in the Glacier County area. There's no implementation plan in place. The Glacier Community Resource Guide will be available in Glacier Community Health Center's medical, dental, and behavioral health waiting areas. Copies will be distributed to businesses that I collaborated with during creation of the guide and that requested a copy for customers. Along with a digital copy will be posted on the website. Anticipated outcomes are that Glacier County community members will be informed of local resources, programs, and services available based on their needs. Increased information, utilization, and access to these resources will help decrease patients' social determinants of health and improve health outcomes. The outputs are creation of Glacier Community Resource Guide, Glacier Community Health Center's Patient Care Coordinator and Administrative Assistant are going to work together to update the Community Resource Guide yearly with any new services, businesses, or coalitions available to Glacier Community or in Glacier County surrounding areas. Photographed here are the Glacier Community Resource Guide cover, along with a few segments of the tables of contents. You can see that the book covers everything from abuse and aging to tobacco quit lines and the Blackfeet Nation Tribal Directory, which is a part of Glacier County. Here are a couple of example pages from the Glacier Community Health Center Resource Guide. It just shows resources and addresses and contact information, anything that I could gather. The book is many pages long, but I wanted to give you guys a few photo options. So work product number 3 was to create a Glacier County Oral Health Provider Resource Guide. This project required collaboration with Glacier Community Health Center's dental director and team, as well as other dental providers and specialty clinics in the area to determine patient options for oral care. The Glacier Community Health Center dental director, Dr. Danielle Kennedy, loved the community resource book I created, and she wanted an oral health focused guide. Through collaboration with the dental team, I determined the resources they are currently using, resources they need, and resources they aren't currently using. I collaborated with the Glacier Community Health Center dental team, dental clinics, and specialty offices to discover services offered in the area. I have gathered a comprehensive list and created a booklet the clinic can have printed to give to patients in need. There is no implementation plan in place. The oral health resource booklets will be available for all departments, medical, dental, and behavioral health. Patients can take a copy if they would like, and the dental providers can utilize the book to discuss a patient's options for care with them. Patients utilize the resource book when needing an oral health provider or when one of Glacier Community Health Center's dentists needs to refer a patient to a specialist and they would like to complete research before deciding where they would like to go. Patients can utilize the resource book to view their options in the area and make an informed decision. Patients can also utilize the resource book to access addresses and phone number prior to their appointments. The Glacier Community Health Center Dental Director will complete yearly updates of the resource book as new facilities open or addresses change to ensure accuracy. Here are a couple of example pages from the Oral Health Resource Guide. You can see listed below are a few denture clinics. None of them are in Glacier County, but the closest one is Conrad Denture Center, which is about 45 miles from Cut Bank or Glacier County. The Denture Care Clinic and First Impression Denture Clinic are in Great Falls, followed by some Kalispell options for patients to view and utilize. There's also, I posted page 5, which is orthodontics for different orthodontists in the area. Patients will also have to travel to Great Falls or Kalispell, which are outside of Glacier County, but they can utilize the oral resource booklet to look at their options and make an informed decision. So let's connect the activities that I completed during my applied practical experience to the competencies they meet. The competencies I chose were 7, 9, 17, 18, and 21. Competency number 17 assesses populations' needs, assets, and capacities that affect communities' health. Supporting documents are my interprofessional collaboration meeting minutes, patient support questionnaires, and community resource guide. This competency was demonstrated through dental, medical, and behavioral health interprofessional collaboration and negotiation of current community needs to create an adolescent and an adult social determinants of health patient needs assessment. The created patient needs assessment will be used to determine the community's strengths and challenges for community well-being. A follow-up review of assessment at 2-month, 6-month, and yearly will be demonstrate improper determinants of health were selected. If other areas of need are noticed, the assessments will be updated by the Director of Operations to meet the community's needs. The clinic's care coordinator will contact any patient who lists a need on the assessment for a follow-up discussion of opportunities and resources. The patient needs assessment will be used hand in hand with a community resource guide. The Community Resource Guide contains valuable tools for all social determinants of health that can be utilized to meet any areas of need. Pictured above is an outline of Glacier County, which expands from Cut Bank to St. Mary's to Babb to East Glacier, which includes the Blackfeet Indian Reservation, all the way up to the Canadian border. Competency number 9 is to design a population-based policy, program, project, or intervention. Supporting documents for competency number 9 are the Community Resource Guide. This competency was fulfilled through the creation of Glacier County Community Resource Guide. Completion of the Resource Guide project was completed through Glacier County, Cut Bank, Browning, Babb, and East Glacier. research, and outreach. The purpose of the Community Resource Guide is to demonstrate the current resources available and effectively link community resources and patients with services that meet their needs. The Community Resource Guide is specifically tailored to Glacier County. Any needs, services that didn't have a resource in Glacier County were still added to the book with the closest options listed. Transportation resources were highlighted to help patients reach resources that weren't close. Competency 17 is to apply negotiation and mediation skills to address organizational or community challenges. Supporting documents for Competency 17 are agenda from meetings, meeting minutes for the patient support questionnaire, and its implementation plan. This competency was fulfilled through interprofessional collaboration, negotiation to create mutually agreeable adolescent and adult social determinants of health patient needs assessments that will be utilized throughout medical, dental, and behavioral health. After holding meetings to determine mutually agreeable primary needs faced by the medical, dental, and behavioral health patient population, an adolescent and an adult assessment were created. A follow-up meeting was held to receive approval from all providers and negotiate any areas of disapproval. At the second meeting, the implementation plan was discussed. By the end of the meeting, the basics for an implementation plan were agreed upon. A follow-up was completed via email to determine whether all providers agreed on a final implementation plan and assessment. Competency number 18 is to select communication strategies for different audiences and sectors. Supporting documents for number 18 are the Adult and Adolescent Patient Support Questionnaires. Adult and Adolescent Patient Support Questionnaire is one of the main goals of the Social Determinants of Health Patient Support Questionnaire is to reach different audiences. This competency was fulfilled by creating a Social Determinants of Health Patient Support Questionnaire tailored towards adults and one tailored towards adolescents. Adolescents face various social factors at personal, family, and community levels. Tailoring the assessment's wording, factors, and colors will help engage adolescents and enable the clinic to receive more reliable and applicable resources. The adult and adolescent assessments were discussed in depth with dental, medical, and behavioral health providers to select areas that fit needs in Glacier County community members. The forms will be available as paper copies and web versions for convenience. Patients can choose which method they would like to utilize to complete their patient registration forms, and the proper age will be auto-populated based on the patient's birthday. Patients aged 12 to 18 will receive the adolescent assessment, and 19 to 99 will receive the adult assessment. Competency number 21 is to integrate perspectives from other sectors and/or professions to promote and advance population health. Supporting documents are my interprofessional collaboration meeting minutes and the final patient support questionnaires and their implementation plan. All of my applied practical projects required collaboration and working with other providers, professionals, and community members. Completing patient assessments requires interprofessional collaboration with medical, dental, and behavioral health providers and administrative professionals at Glacier Community Health Center to agree upon a form, content, and implementation plan. Completing the Glacier County Community Resource Book required collaboration with community members, businesses, and coalitions via phone, email, and in person. In conclusion, I enjoyed experiencing and learning from a real-life implementation of public health knowledge, interprofessional collaboration, and community involvement that we learned about in the EWU Masters of Public Health program. My experience at Glacier Community Health Center pushed me outside of my comfort zone with administrative tasks and extensive community and coworker collaboration. I will utilize these collaborative and administrative skills daily in my future public health career. The key takeaway from my applied practical experience at Glacier Community Health Center is that combining collaborative and individual efforts can drive powerful resources in our community to increase the public's health. Throughout the course and my applied practical experience, I was able to build on existing and develop valuable new professional skills. I sustainably built upon my experience collaborating with other professionals and community members to increase patient outcomes and the information collected and strengthen my leadership confidence. I led my first interprofessional meetings with medical, dental, and behavioral health providers. I learned about the daily administrative tasks faced by different public health administrative professionals, and I was able to help them tackle projects to increase patient care. My site supervisor, Dr. Danielle Kennedy, provided me with encouragement, oversight, and feedback throughout my applied practical experience. She was also attentive to my career goals and introduced me to the Montana Primary Care Association director, many dental directors of Montana Community Health Clinics, and the administration at Glacier Community Health Center. I will continue collaborating with Montana public health professionals as I search for my place in the public health workforce. My applied practical experience required leadership and interprofessional collaboration, which I was initially intimidated by. Dr. Danielle Kennedy reinforced my confidence in my ability to communicate professionally and complemented the confidence I brought to the table when meeting and collaborating with people for the first time. I did a thorough job completing each aspect of my 3 projects, and I feel confident in the clinic and community resources I produced. My applied practical experience reinforced my strong organization, problem solving, and creativity skills, but I will continue to practice collaborating with other professionals to increase my communication and leadership skills. Before the Master of Public Health program, my career was strictly clinical. I don't believe I want to give up my clinical practices completely. However, I believe I can assist my community and public health center in leadership, administrative, and community outreach, areas I hadn't previously considered. I want to continue exploring public health work areas where I can make a difference. Thank you for viewing my presentation.